There we go. Now we're live. Okay, so welcome everyone. Life's Co-Pilot is always excited to be able to bring you experts on different topics to help you figure out what's going on out there. And so we get, rather than getting information from your brother's uncle's barber, we can get it from people that really know what's going on. And so today we're very excited about how Life's Co-Pilot member, Dr. Judy Olson, who's an audiologist. Did I say that right? I hope.
Yes, audiologist.
And we're going to learn about hearing and all the different things that go along with that. So I'm going to go ahead and turn Dr. Judy loose. She is the owner of Hearing Solutions of Indiana. And Dr. Judy, welcome to it. I'll let you introduce yourself further than that and tell all about your wonderful business all over the state here. So, and then we'll
okay.
get
Thank you. I'm Dr. Judy Olson. I've been an audiologist for a little over 21 years. I had a practice in California, and then I came back here about 11 years ago. And a few years ago, 3.5 years ago, my husband and I were talking and decided to go ahead and open up our first practice. And we opened in November of 2018. And then we started seeing opportunity and gaps in care around different parts of Indiana. And we have grown from a very small staff of 2 to 16 full-time employees. And we have 7 locations around the state, including IU Health Arnett here in Lafayette, Indiana. And it is our mission to provide hearing care to as many people as we can, and to keep people connected with their loved ones and their lives. That's kind of like our driving force, is to keep people connected with their loved ones.
Well, that's very exciting. I know that we were just talking about this before we went live, but I just sent my uncle in to see you. He's 92, so he went to your Fisher's location yesterday, and I was suspicious that maybe he might need some help, and he does, because I've been in too many conversations where I'm going, he's answering questions I didn't ask, and vice versa, whatever. So we're going to get that taken care of here shortly. So I'm excited about that. But I can tell you from a personal experience, I came to see you because I kind of got guilted into it. That I'd never been to to have a hearing check since maybe grade school. And I will say this, you scared me when you sat there on the other side and said, wow, I was like, oh my God, what is it? And I was good. So, anyway, it's not scary and it's not painful. Go see Dr. Judy. They're nice there. So anyway, so tell me about tell me about this. I guess, what is, your hearing health? Tell us some stuff that, that people need to be aware of and what they should be looking for and doing and stuff.
Well, one of the things that has always struck me, I'm kind of a numbers person, is, and I give a lot of presentations and talk about, health concerns of seniors. Basically anybody over the age of 55, not that I consider 55 a senior, but anybody over the age of 55, what are the top health concerns facing our aging population? And the first one is hypertension, high blood pressure. Number 2 is arthritis. And do you know what the third one is?
I'm going to make a wild guess. Is it hearing?
It's hearing. Yeah. Yes, it's hearing loss. Now, the reason that is so shocking to me is because that means it is actually more prevalent than cancer and diabetes. Let me repeat, hearing loss is more prevalent than cancer and diabetes. And that really stunned me a little bit. And it made me realize, how important it is that we are on this mission to help people hear better, because it is one of the top 3 health concerns facing our aging population today.
Well, so what are some of the things that happen, when people ignore it? For what kind of things can that spin off and do? What kind of things can they get themselves into other challenges with?
So it is actually very common for people to wait 7 to 10 years after they notice a problem, before they ever come in for a hearing test, which is kind of an amazing number to think about as well. But the thing about hearing loss that's very different than other health concerns is typically there's no pain involved and it's invisible. So if I walk around and I broke my arm and have a cast on my arm, then everybody knows, oh, she broke her arm. But if I walk around with a hearing loss, it's invisible. Nobody can tell right away that you have hearing loss just by looking at you. And so a lot of people do ignore this for years before they do something about it. And usually there's some catalyst or some event that happens that finally either a family member drags them in, a spouse drags them in and says, I'm not doing this anymore. Or, they themselves realize that something happened that really impacted their life. And then they finally come in to get a hearing test. But what happens during that time is it gets more and more difficult to hear and understand. So when we have normal hearing, listening and hearing is a very passive activity. That means the brain just kind of does it. We can hear, we can understand, we're connected to people, having conversations. And it doesn't take a lot of effort. Our brain just kind of automatically does it. It doesn't take much hearing loss to throw that off. And now instead of being passive, a passive activity of the brain where it just happens, suddenly it becomes an active activity of the brain, meaning it takes active work, concentration, and focus just to hear and understand people. So as time goes on and we ignore these issues, maybe we turn up the TV a little bit more to accommodate, maybe we sit closer to accommodate, maybe we look at people's faces we actually start lip reading a little bit, whether we realize it or not. But as that time goes on, it becomes more and more difficult. And then what people end up doing is they end up starting to retreat or withdraw from social situations because the amount of effort it takes is so great that it just leaves you exhausted at the end of a meal in a noisy restaurant. And so people end up backing out and saying, oh, it just takes so much effort, I'm just going to hang out here by myself, kind of thing. And so then we start becoming disconnected, and we need to stay connected to keep our brains active. We want to stay involved and stay connected and keep our brains active. So that's kind of the progression that we see in a lot of people as the years go on and they leave their hearing loss untreated.
Well, so something you were heading towards there, is it a catalyst towards like that cognitive decline and things like that as well, or?
Yes, there is a definite link between untreated hearing loss and cognitive decline. If I were to give you a list of, signs and symptoms of early dementia and Alzheimer's and untreated hearing loss, those two lists overlap. Things like becoming more grouchy. What we don't realize is the energy we're expending just to hear all day, and people become very short, very grouchy, short fuse, and withdrawing, and eventually that can lead to cognitive decline, confusion, dizziness, even like a lot of negative side effects can occur from untreated hearing loss.
What would the other things that I'm thinking of as we're talking here is potentially like for depression and things like that because of the kind of social isolation and what have you?
Yes, it also can cause depression, anxiety, stress. Anxiety and depression are big ones that can be caused and linked to untreated hearing loss. But the general public typically doesn't even understand that link. And it's easy to say, oh, that person's just aging, so they're not as well as they once were. But a lot of times the reason for that is lack of hearing. I have seen the most amazing transformations in front of my eyes in my practice with, actually just the other day, a woman brought her mother in. Her mother was in her 90s and her daughter was like, I don't know what to do, but she can't hear. And I really missed my mother. And I ended up fitting her with hearing aids, and there were just tears all around because this woman that barely said two words when she came in, like I I was actually, sorry, I got a phone call. I had to, no, I actually was, sorry, that threw me off. I was actually so amazed because when she came in, she barely said 2 words and seemed like she was really out of it. And I put the hearing aids on her, and this person just came alive. It was amazing to see the difference. And then the daughter, of course, was crying because she was like, "Mom, I got my mom back." It was the most amazing thing. So I see that time and time again. So there's just no doubt in my mind that our hearing health is so important and really should be treated like all other medical conditions that we go get help for.
Well, do you think that why do you think it's that people wait 7 to 10 years? What do you think is it just they don't think it's that bad? What is it you think that we need to do to create that catalyst?
Well, sometimes the catalyst just happens. Like I had a patient that when the day she realized she needed to come in was because she was talking to her girlfriend and she was doing the nodding and smiling and agreeing thing, even though she wasn't hearing. And she said her friend said something and she goes, "Oh, that's lovely." And her friend goes, "You think it's lovely that my dog just died?" I mean, that and that was the thing for her. That was the straw that broke the camel's back. And she said, "Okay, I've got to make a call." The thing about hearing loss that's tricky is that most hearing loss happens very, very gradually over a period of years. So it's kind of like weight gain where you gain that 5 pounds a year very slowly over a period of years, and then at 10 years you look up and go, "Oh my gosh, I put on 50 pounds. How did this even happen?" But see, our brains are funny. They kind of rewire themselves to think, as your hearing starts to normal and then it creeps down and creeps down, our brain rewires itself to think you're actually hearing everything, but you're not. So normally it has to go, it will creep and change a little bit, at a time. And then there comes a day when it just crosses over this one point, and then it's like, bam, suddenly there's a need. Suddenly it's a lot more noticeable. So the impact becomes a lot greater at a certain point.
So is there a suggestion, in your profession as to how often you should come in just to get tested, just get baselines to find out, hey, am I okay? Or maybe I didn't even know I was having issues, that type of thing. Is there something that you would recommend to keep from letting yourself spin downward?
Yeah. So to be more proactive,
Mhm.
yes. First of all recommend anybody from the age 50 on up. It's kind of like if you're old enough to get a colonoscopy, then you should get a hearing test, get a baseline, because based on there's a lot of different things that can impact your hearing, especially as you age. But anybody who, if somebody is complaining that you're not hearing them, if somebody's complaining that the TV's too loud, it's time to come in and get a test regardless of your age. If your neighbor knows what episode of NCIS you are watching, it's time to get a hearing test. So, if you notice you're saying what or huh, or actually having disagreements, maybe at home because you heard something a certain way and the person you're talking with heard something a different way, there might be, it's time to come get a hearing test.
So how often do you recommend doing that? Do you recommend every 5 years, I mean, what's your, or is there any suggestions on continuing to make sure you have hearing health?
Yeah, usually at the age of 50 and on up, we would recommend an annual hearing screening,
Annual?
or
Okay.
or certainly if you notice anything.
Okay.
Yeah,
And it's pretty unpainful from what I experienced. Okay. It's, but
right.
put me in a little box and beep things at me. So,
It's
but
pretty painless, yes. We
so,
like to we try to make it fun.
yeah, exactly. So, well, so tell me what do you, so basically 50 and up is where people need to be starting to pay attention. Okay. Obviously
Yes,
all up until that time, that doesn't mean you're not supposed to pay attention, but
right.
so what is there anything that we can do to protect our hearing and things like that maybe we've heard, maybe we haven't heard, that we need to be paying attention to?
Yeah, so I have patients that over the years, first of all, there are a lot of careers that involve a lot of noise exposure day to day on the job, construction, factories, but also things that we don't think about as much, like the dentist's office with the drills. I have a lot of patients that are dental hygienists or dentists. Also, things like vacuuming or mowing the yard. These are situations where you should be wearing protection, but we don't think about it because we may not think it's enough to do damage, but they actually are. Noise exposure, hunters, guns, motorcycles, I call them loud hobbies. Those kinds of things, it's very important to wear hearing protection. The sirens on, for firefighters and police officers, the loud sirens actually are loud enough to cause hearing loss. So all of these things are reasons why to be proactive. A lot of people that work in factories and things like that, they could start showing signs of hearing loss at a much younger age because of the pounding that their ears take at work every day. So it's just important. Now, theoretically, they're supposed to have their hearing tested, a lot of them they have annual OSHA screenings. What I'm finding out is not all factories and not all organizations actually follow all of those rules like they're supposed to. So I do feel it's important for people to be their own advocate as well. And it's also important for people that are working in factories and whatnot, or as they age, to know that, the job of them is to do those annual screenings, but it doesn't necessarily mean that they want to help provide hearing aids for those employees. So there's just a number of reasons why to start getting your hearing tested at, say, at the age of 50, or if you've noticed that you're turning the TV up, or that it's becoming very difficult to hear in noisy restaurants. That is one of the number one complaints of people that are on the earlier spectrum of hearing loss, more mild losses, is it doesn't take a lot of hearing loss to make it very difficult to hear if there's any background noise. So those are all things to watch out for.
So when are doctors attuned? I'm not talking about audiologists, but are doctors attuned to this as something they need to be looking into if they're dealing with a dementia patient, or a potential dementia patient, or a potential depression patient? Are they asking these questions and saying, hey, go see Dr. Judy, or whoever? Or is that happening in the medical industry? I understand that most doctors have 6 minutes for the client. Okay, so right. I don't know if that's happening or not, or can you tell me, are people having other medical professionals paying attention and helping?
I'm going to say not enough.
Okay.
Not enough for sure. So the primary care physicians routinely only send 15% of their seniors for hearing evaluations. And why that number is so low, I have no idea. It really should be a routine part of care for people age 50 and up. So we can call the doctor's office if somebody comes to us, we do a screening, and the hearing's not normal. That gives us the ability to call the doctor's office and request a referral so we can continue on and do the full diagnostic hearing evaluation. But hearing testing isn't free. We do consultations where you can come in and have a free consultation, but we do a deeper, more medical based evaluation if it is a referral from a physician. So there are some differences between the evaluations.
Well, the reason I ask this is because I'm noticing this in so many different aspects of healthcare. Is they should be getting these recommendations, but they're not. That's what I'm trying to figure out, how, how we can better educate I guess the professionals as well. So
Yeah. So we actually have an outreach coordinator who, Amy Harris. Um, we actually send her to area physicians near all of our practices so she can have one-on-one conversations, or we can do like a lunch and learn, or discuss with the physicians and the referral coordinators at each office, what to look for, things to look out for, and comorbidities that are very common with hearing loss, like diabetes, cancer treatments. There's a lot of medications that also are shown to cause ringing or tinnitus in the ear, or actually hearing loss. So, she's actually very proactive in going to the doctor's offices so they are more aware of what to look for and what to refer for. Unfortunately, modern medicine in the United States does not allow physicians, like you said, more than 6 minutes with a patient. And that comes down to insurance payments. So a lot of physicians actually are paid based on how many patients they see. So the more they see in an hour, like they now they have to see 15 patients in 15 patients per hour versus 3 from 10 years ago to make the same amount of money, kind of thing. I'm just throwing some general numbers
right,
out,
sure.
but just so you get the idea, so it really has put a squeeze on our physicians in this country. So while we're quick to complain about it, it's very difficult for them because they also have employees to pay and practices to run, and they can't do that if they don't have the revenue. And the only way they can drive that revenue is by seeing more patients within each hour time block. So it is very frustrating. So in general, no, hearing loss, again, being invisible and something people don't complain about to their doctors, it's a problem that is not top of mind for most physicians, which is why there's a very low referral rate, unless the patient specifically asks to be referred. So I always recommend patients to be their own advocate, to be, they need to become advocates for their own health care.
Yeah. Well, I can see so many things, I can see depression and cognitive decline being a very easy thing to see the connection, if you're disconnected and unplugged, basically, so that makes sense to me. So anyway, I was gonna say, I see Amy on here as well. I know that you guys are doing stuff. Amy's doing stuff with senior communities. We're teaching, the senior communities to be able to communicate with the people who are deaf there, which I think is a phenomenal thing that you guys ultimately are doing together. So that's phenomenal. So well, tell me what we've been doing a few things about how we're going to protect our ears. We're going to do things along that line. What do you think that some people avoid coming in, especially maybe our seniors, because Medicare, unless you have the Advantage plans that roll hearing in, don't pay for hearing? Do you think that people are afraid to come in? Kind of like, dental and hearing, I have a feeling that some people avoid because they don't think that it's available to do.
Yeah, that is a big problem in this country as well. I will tell you though, that is not the number one problem with people getting help with their hearing, because they've done a study. There's been several studies done, but one of them, and I don't have it in front of me to tell you, to cite the actual source, but there was a study done, and in England, hearing aids are free. So for people, because it's covered through their taxes and whatnot. So their help rate, meaning the number of people that actually get hearing aids, is barely higher than here in the United States, where people have to pay for their hearing care. Because you think, what's the biggest deterrent of people getting hearing aids? And the first thing that comes to mind is cost. And while I think that there are a lot of questions around that and a lot of concerns around the cost, that actually isn't what is, I feel, the biggest deterrent of people getting help with their hearing. I think the number one reason people don't come in is actually fear. I think it's less about cost and more about fear of the unknown. And so that is where, I mean, you've been to one of our offices, you know, there was nothing to be afraid of, and we make it very painless, and we have a very nice, warm and welcoming office and staff, and we take great care of our patients. So once they come in that door, they're able to kind of like breathe a little bit and go, okay, this isn't going to be as scary as I thought. But I think fear really is the number one reason. And I mean, the cost does play a part. Most insurances don't cover any part of hearing aids, and some do. And the ones that do, we're credentialed with all the major insurances, and most of them, you know, any of the big ones that we do take and can bill for. But most insurances just don't cover any part of hearing aids. So Medicare really is kind of in line with most insurances. Those Advantage plans, however, it's kind of complicated, you know, with insurance. They really don't want you to really have a great understanding of the insurance. I don't know if that's your experience. That's been my experience.
Yeah.
But those Advantage plans aren't always all they're cracked up to be with the coverage for the hearing aids either. So it's, you know, the best thing to do is to treat the hearing like all other medical things that you deal with, all other medical concerns, and go to a doctor of audiology, you know, to provide that care, and then, you know, get the best treatment possible.
Well, I think that, you know, I know, like I said, I just happened to, you know, it was kind of ironic that I have a family member that was there yesterday. So, you know, so I have a little bit of a different understanding than I would have the day before yesterday.
Sorry.
But from what I could see, it looked like it was that you have reasonable terms that you can work with people and help them accomplish things. So, you know.
Yeah, we have financing options to make it very affordable for people to pay a very low monthly rate and walk out with hearing aids that same day. So it's very exciting. And that is something we do differently than most audiology practices, is we carry a lot of stock in our practices. So this patient has waited 7 to 10 years to come in my door, and they don't want to wait another minute once they make up their mind that they want to do something. So we allow for same day fittings, which is very exciting. So you can come in, have a consultation, and actually leave with your hearing aids the same day. It's very exciting.
So that literally changes their life from walking in the door. So.
Oh, unbelievable. I mean, and we see lives change every day in our practices, and it is the most incredible thing to witness and be part of. And we're super proud to be part of that process.
Well, that's very cool. Like I said, I saw the terms, you know, just because I'm the POA and the guardian too.
Yeah.
So, but anyway, so it's so anyway, I saw that's how it may not be as scary to people as they think when they see numbers. Okay, so
That's right. Yep. And we'll explain all that when they come in, what their options are. A lot of places you go to, well, first of all, if I can explain a little bit about who, you know, what makes me different
Yes,
than some of the other places around town. So a lot of places have, when you need help with your hearing, there you've got two choices of who you go to. You can go to a doctor of audiology who went to school for 8 years, have really put their life savings into being educated and working in honing their craft, and lots of experience in education and background. Or you can see somebody who is called a hearing aid dispenser. A hearing aid dispenser in the state of Indiana is someone who has their high school diploma or GED or equivalent and went to Indianapolis and took a state licensing test. So you literally could be seeing somebody who's a doctor who's gone to school for 8 years and worked very hard to be the best, I feel, and work very hard at that. Or you can see somebody that literally last week was selling tires and this week they're fitting you with a medical device. That's the reality of your choices. The other thing I like to explain to people is I don't ever recommend you get a medical device where you also can buy tires and toilet paper. So meaning the big box stores, that I would never do anything medical at a big box store. So I'm not even sure how this came to be. That is my own personal and professional opinion, but I see so many patients come through my door who bought hearing aids at a big box store or a couple other very popular brands that are very good at advertising, but they don't have somebody with the expertise and background working there that they need. And they've bought hearing aids that they're very unhappy with and very dissatisfied because they don't work for them. And it's very sad because there's no way for them to recoup that cost. And a lot of the hearing aids that are bought at the big box stores or a couple of these other very famous brands, shall we say, where they can only fit one brand, they're locked and we can't reprogram them, and we cannot then fit them to that patient. I could fill this room with the hearing aids that have walked into my office that people are very unhappy with, that they bought at those kinds of situations.
Well, I mean,
Yeah.
I assume if someone buys one from you and you're going to tune them to them and do all the things that, that maybe the tire store can't do, but
Yeah, so the a hearing aid actually is only as good as me. So I tell people too, when you're looking for hearing care, it's less about the hearing aid. The hearing aid is very important. The devices are very important to get, great devices, but also you're actually looking for me as the provider. Myself or the other doctors that I have hired at Hearing Solutions of Indiana, or for people that aren't in Indiana, I strongly recommend you find somebody who's a doctor of audiology, because the chances are you're going to have much better care, a much better expertise in that person who's fitting you or your loved one with the hearing aids.
well, I would imagine if you just take a test, I wasn't really aware that this was the case, but if you can have somebody can go, take a 2-week course or something, or a week, I don't know how long it takes to get the test.
Well,
but
it used to be that they had to have a certain number of hours working under kind of like an apprenticeship, but a couple years ago they removed that requirement. So now literally anybody can go to Indianapolis and take a state test and become a hearing aid dispenser, which actually I'm going to tell you, I've known some great dispensers in my life as well. And so it actually is also not appropriate to be able to provide that for people with no experience. So it's just food for thought. You have a choice. You have a choice in who you go to for your hearing health care. And so I strongly recommend you make the choice of investing in a doctor of audiology who in general is going to have a much better training and expertise on, how they're fitting the hearing aids.
when someone does like get hearing aids with you or what have you, or one of your firm, what's the process? I mean, what's it like to be that customer? I mean, do you put it in and you walk out the door and you're done, or is there like follow up? How does that work?
Well, it's a patient by patient case.
Well, I get that, but yeah.
But typically the patient comes in, we do an evaluation and consultation. We find out who they are, what do they do, what are their activities, activity level, how social, what are their needs. Like, we get to the bottom. It's not a one size fits all. What are their needs? So we get to the bottom of what are their needs, why are they here. Then we do an assessment, and then we'll talk to them about the results. And based on those results, if hearing aids are recommended, then they can go ahead right then and there and be fit that day in most cases. Sometimes we have to order something special for that patient if it's a custom order, but then we fit the patient, we customize the fitting for that patient. And typically we'll have them come back in a week for their first follow-up, sometimes another follow-up after that, depending on how they're doing and what their experience is. And then from then on, it's usually every 3 to 6 months and whatever they need in between.
Okay, so you're there. It's an ongoing process. It's not like I wouldn't imagine the big box stores have somebody there to keep tweaking for them.
I can't really speak to,
I know, but I just can't imagine it. But anyway, yeah. So yeah.
I do know they don't have the care that we have. Like when we have somebody walk in our door, we really want that patient for life. We want to work with them and keep them on the road to better hearing, and hold their hand as we take that journey together with them and get them in the right devices and get them the right care, so that they can be connected with their loved ones.
So on the let's just trying to think where I was going to go with this. I had a question. Now I'm drawing a blank. That's for another panel later. You know why that happens. But oh, okay, I know what it was. If you're dealing with like an elderly client or what have you that may not be real tech savvy. I remember when I was in there, you guys were showing me some of the bells and whistles that some of these things will do now, and they can be pretty techy. Obviously you don't have to be techie to make these things work. So, is there different kinds? Is that what it comes down to, or what?
Yeah, it kind of depends on the patient and their needs, but there's a wide range of prices and levels of technology depending on what each patient needs, and that will be an individualized choice. And some patients say, oh, I don't need all the techie stuff. I want it as simple as possible. And I'm like, great, then let's go with a more premium product that's very automatic. So the higher the level of technology, the more automatic and the easier it is for the patient. Most of them are rechargeable nowadays. So most of my patients, I like to make it so their job is to put them in the charger and put them in their ears. Simple. Keep it super simple, right? And our offices are open any day of the week. Our offices are open. You can go in and for a clean and check, and it doesn't actually matter where you got your hearing aids. We'd love to, take care of people and help keep their hearing aids working. When it comes down to, like you said, like the individual process for each patient. So when you're looking for hearing aids, this is not the time to try and save a couple $100s. So I always tell people too, I make this analogy with, flat screen TV. You go into Best Buy, there's like over 450 flat screens all on the walls, and you walk around and you're like, oh, this one does this and this one does that. How can I walk in there, I don't know the difference of all these TVs, but I know when I look at it, which one has the most amazing picture. Well, the same thing happens when you come to us. There's over 450 different hearing technologies, and that number is growing by the day. As a consumer, you can't possibly know the difference. So you really have to turn yourself over to me and trust me that I've done the research for you and I have your best interests in mind in helping you select a product. And so, we're not the low price leader. I have very good doctors working for me, and we're not the low price leader. We're also not going to be the most expensive either, but we're very good value and really the best care for your loved ones.
You were talking about you were using the TV analogy, and you walk in and you see all these different TVs. That also comes down to personal taste too. What I think is a better picture and what you think is a better picture could be two different things. Is that something you do when you're working with the client with their ears, so that what feels right to them? Is there that kind of a nuance to it as well, or?
Yeah. So there's a lot that goes on in our brain with processing sound. So I might fit hearing aids on a patient. Usually we get it right off the bat, but I might fit a certain set of hearing aids on a patient and think, oh, they're going to do great with these. And they come back for their first follow-up and I'm like, wow, I'm not sure I'm happy with how this is going. And I'll tell patients, if this isn't going great, we're going to be having a conversation about it. And, based on their feedback of how their week went, I'll go, you know what, based on what you're telling me, I think that this other pair might be better suited for you. And then we can switch them right then and there. And then usually if this one doesn't work, this one works great, and vice versa. So,
so you'll even trade them out down the road?
Yes. Yeah. With it, everybody, Indiana state law, you've got a 30-day money back guarantee. And so within that 30 days, we do have time to switch them out. Typically you'll know within a couple weeks if there's an issue. Usually there's not, but if there is.
Well, I didn't know that either. That should give people a level of comfort as well, that they're, you're not stuck if you go, oops, I did the wrong one. So.
Right. Which is also a reason to go to an independent provider like
Mhm.
us, because we have access to basically everything on the market. So we work with the top 4 manufacturers in the world. Um, and that allows us a choice, the doctors a choice, and the patients a choice. Versus a lot of these places that have one brand. If that doesn't work great for you, you are stuck because there's no other brand that that person is allowed to sell.
Yeah.
So I'm just being very honest and probably saying more than I should, but I mean, the
Well, it's the
reality
same
is
thing
what
like
it
with,
is.
my son owns an insurance agency and
Yeah,
he's an independent. So they've got hundreds of different ones they can
right.
tailor make for you rather than getting stuck with a captive agency where they can only sell you this one brand and what's in the
Right.
shelf. Yeah. So,
Right. Choices are very important, especially these days with the world of internet and research that you can do at your fingertips that, 15 years ago, 20 years ago, it wasn't a thing. And so it's very easy to get information nowadays. But back to the TV analogy, when you buy a TV from, say, Best Buy, that tends to be where we go. It's a one and done. You go in, you buy the TV, you leave, you've got your TV, you go home, put it up on the wall or the stand or whatever. That's the end of your relationship. With hearing aids, it is, although they are electronic devices, they're medical devices, and it is an ongoing relationship. You come back, you know, every few months, you come in for service, check and clean. You can bring them to the desk. Like you have to, they require routine maintenance, kind of like a car. So, when you come in and have them cleaned and checked, it's kind of like the equivalent of getting oil changes throughout the year. And in order to keep those devices working well, that's what you have to do. So it is not a one and done. And that's why the choice of care is so important as well, because it's a long-term care service contract basically that you are, getting into with that provider. And so it's very important to feel very comfortable right off the bat that, that you're going to feel comfortable coming back for services.
well, that's very good to know. What's a reasonable time frame that they should a pair should last?
The hearing aids last on average about 5 to 6 years,
Okay.
and then it's time to get new ones. As an industry wide, the average is every 4.5 years people start upgrading. The reason for that is that the max amount of warranty you can get from a manufacturer is a total of 4 years on a new products. So most hearing aids, a lot of the hearing aids we do actually have a 4-year warranty, so anything's covered for 4 full years. They're even guaranteed against loss and damage.
Wow.
So it's pretty amazing. The protection that we provide. So because of that, I think that's why most people upgrade at the 4.5 year mark.
Okay, I got a question for you. What got you into this field? How did that what pulls you in the door to get into this field?
Well, I started learning sign language when I was 16 years old. And then when I was at Purdue, I was the president of the ASL club. But when I first went to college, I was in math. I was a math major, and I just realized that wasn't going to make me happy. So I did some soul searching, and I had heard about audiology as a career. And I started investigating and decided to go ahead and go into audiology. I was like 19 or 20 at the time. And it's a really wonderful profession. It's a very, very motivating profession. It's wonderful to work with people. I'm a people person, but it involves math and science and psychology and all of these wonderful things, and computers. It involves technology. Like, it's so cool. It's such a great field. So it just kind of grew, and I went ahead and finished out school and went on to get my doctorate, and here I am.
Oh, very good. Well, how many? You told me you have what, 6 locations now? Is that correct, or how many locations?
We have 7 locations.
7.
Six.
And where are they? I know Lafayette. I know Fishers. Where else are you?
So we have full audiology hearing aid clinics in Lafayette and West Lafayette, and we were asked to take over IU Health Arnett. So actually, this is where I am right now today. I'm in the basement of I'm in the ENT department here at IU Health Arnett in Lafayette. And then we have our Zionsville location, Fishers, Carmel, and Avon.
65, and now you're starting to head up 69. So,
Right. So it's been quite an interesting time. It's been amazing. We've had some amazing providers come and want to work with us. And so we've gone ahead and continued expanding to bring hearing healthcare to more people. And
excellent.
some of the areas we're at in like Fishers and Carmel, there was a big gap with no provider. So we decided to go ahead and become a provider in those areas because we felt very strongly there was a need.
And there just wasn't another audiologist there other than the big boxes, and they were not doctors.
Right. Nowhere nearby. Yeah.
Yeah. Excellent.
Yeah.
Well, I'm glad to, I mean, you guys have been growing like crazy. I remember when I was at your grand opening in Zionsville, so it's moved very rapidly. Well, that's excellent. So tell me what it's like I mean, I know what it's like. I've been there. Okay. But when they watch this video and they're going, well, I probably ought to at least get this checked out. Tell me what the process is. They call and then tell me kind of what they're going to experience. I mean, I've been there, but I'm going to let you do it. So,
Yeah. So, when they call, we'll go ahead and ask a couple questions and get them scheduled with one of our awesome doctors at whatever location is convenient for them. And then they'll come in, and like I said, the doctor will meet them, greet them, and kind of find out more about why they're there, what they're looking for, and what we can do to help. And then we'll do an evaluation, talk about the results, explain the results very thoroughly. We do a lot of patient education at our practices, which is something that the physicians and ENT docs don't have the time with the patients that we do. We don't overschedule ourselves. We allot the time needed that you will need because your time is very valuable to us. So we tend to run on time and take wonderful care of our patients. This is why we have over 400 5-star reviews. Nobody else in Indiana can say that. Most audiology practices can't say that. But this is why we have so many amazing reviews from our patients. They feel the need to share their experience because we really do our absolute best to take care of our patients. But anyway, at that appointment, the doctor will discuss everything in detail and answer any questions the patient will have, and then they will come up with a treatment plan together. If they're a candidate for hearing aids, or do they need to be referred on to an ear, nose, and throat doctor for a medical intervention. So some patients, we help them by sending them on to an ENT because they need some sort of medical intervention that is not hearing aids. So we also are a great first stop for patients that are having issues with their ears and they're not quite sure what to do. Come see us. We can hopefully get to the bottom of what's going on, or refer on to an ENT doctor in the area for continued care. And we coordinate with the ENT doctors within all of our offices, where we coordinate with the local ENTs.
Excellent. Well, that's interesting. That's good to know that you're a stopgap there as well. I know that doctors will also send people in to like eye doctors to watch, to look for like potential diabetes things and other things.
Right.
So I didn't realize, I haven't thought about that. So you're also there to catch things that other people aren't catching too, right?
Absolutely. Yeah, absolutely. So there are certain things that require medical referrals out, and we don't ignore those. But I in our industry, I have seen many times where something like that was ignored. So the patient would purchase hearing aids and they ignored something that later on ended up being a real medical issue. So our doctors are going to refer out to an ENT as needed to do what's best for that patient.
Well, and I would imagine in your doctoral training, that you are more attuned to seeing that than someone that just went and got a license.
Yeah.
To
Yes.
see what's
And
underlying causes,
yeah.
Very good
Yeah,
point.
and
Something I hadn't even
yeah.
thought about. That's good to know. So, well, I'll tell you what, these things always go faster than I expect them to. But I really thank you. Is there anything that you'd like to say that we haven't covered that you want to make sure that people are aware of?
Just if you are on the fence or have been thinking about it, or if any of your friends or family have said you need to go get checked out, just go to indianahearing.com, indianahearing.com, and people can go ahead and schedule right on our website. So otherwise, they can call our number in the Indianapolis area. It's 317-973-7109. And we'll be very happy to take your call and be of assistance.
Excellent. Well, I'm going to do a quick screen share here real quick, just to kind of show you what's coming up. So obviously we just completed this particular one. This is on Life's Copilot. You can always come here and go to events. And like, for instance, our next one is on February 10th, and it's going to be on where do you want to live in retirement. We have people from different aspects of that. One coming up on the roadmap for elder care. We've got Christy Freeze coming, and she's got a book basically to help people do that. I got Dustin Ziegler with he's the second in command over at Socoa coming in, talking about what the state of aging is in March. So we have one on common myths of VA and Medicaid. So you can always also come in here into the resources, go to video library, and this video will be there probably by tomorrow. Okay, so we have those, but you can come to events and you could go to resources and see again this video and other ones like it that are there. So we try to provide that content, so you're getting the information from these experts as opposed to somebody that's just throwing out information. So, but anyway. So, because I know people always go, well, you know everything. Or no, I don't. I just know who knows things. So I know enough to be dangerous, but I just point people in different directions. So there's the expert over there. So, well, thank you for coming. Thank you for sharing with us. I really appreciate it. So you'll get a copy of this one as well, and it will be, of course, on Life's Copilot, and we'll have it on social media and what have you else. So
thank you so much. I appreciate it so much.
Thank you much. Take care. Bye-bye.
Okay, you too. Bye.